Before we get started, I thought I would talk to you guys about your weight. And then I thought, who wants to talk about that? That's just going to make you depressed. So then I thought, well, let's just talk about depression. So, did you know depression is a greater indicator for falls than age? And what happens when we get depressed? The brain shrinks. It impacts our brains greatly. We're going to get into that really quickly, but first, let's define depression, which is, unfortunately, a big issue with our younger generation combined with anxiety. Depression is also a big issue with our senior population. 65 and older is what I'm defining as senior, okay? Now, social isolation is a big part, a big cog in that wheel, and we're going to get to that. Let's define depression. Depression is a serious mood disorder. It can affect the way you feel, act, and think. Depression is a common problem among older adults, but clinical depression is not a normal part of aging. In fact, studies show that most older adults feel satisfied with their lives despite having more illnesses or physical problems than younger people. This is something that I've learned too, guys. The older you get, the more you lose. And the more you lose, the more you appreciate. Okay? Now, if you've experienced depression as a younger person, you may be more likely to have depression as an older adult. And these factors are related to the risk of depression. Now, these factors are related to the risk of depression. Medical conditions, genes, stress, including caregiver stress, sleep, social isolation. We're going to focus in on that one. Functional limitations, making engaging in daily activities, daily lifestyle activities difficult. And then also addiction and alcoholism. Now, all of this is from the National Institutes of Health, guys. Social isolation is closely linked to depression. Now, here's what I want you to pay attention to. Results indicate that the likelihood of seniors living alone and reporting depression is the highest among those 80 years and above. The odds of depressed seniors reporting falls is the greatest among 60 to 69-year-olds. That was a bit surprising to me. So what they're saying is, the older you get, the more likely you are to live alone, but the more falls that are being reported is in that 60 to 69 age, not that 80 and above age, right? So the numbers, the way this rolls out, guys, the social isolation is closely linked to depression and falls late in life. Here's what happens. Someone falls, they're embarrassed, they think to themselves, I don't want to go into a home, I want to live at home for as long as I can for the rest of my life. So what I'm going to do is I'm going to move less. I'm going to sit more and move less. Problem. Leg strength is gold. You heard me say that at the beginning of the class. If you don't use it, you lose it. And the muscles start to atrophy. And what happens is your fall risk goes up because you don't have the strength to control your body in space. If you stumble, if you slip, if you fall, right, you don't have that strength in your legs and your core to control yourself. Also, people remove themselves from their social activities. One thing that is important to note with Balance University. In 1955, at Yale University, Dr. Rady discovered the brain was malleable in an experiment he did with mice. What he noted were novel events. Two of those novel events we do right here in class: socialization and exercise. That creates chemicals in the brain that help us to memorize thresholds, such as falling thresholds, right? So I can detect those quicker and avoid a fall. The numbers, guys, in 2007, German researchers found that if you exercise prior to a word memorization game, you can memorize up to 20% more words if you do exercise. So all of this factors into what we're doing. Let me leave you with this. About over half of our older adults, 80 years and older, that's about 51%, were living alone. In contrast, about a third, 70 to 79-year-olds, and about a quarter, that's about 34%, and about a quarter of 60 to 69-year-olds, about 25%, were living alone.